First of all, I have to say that I feel deeply humbled that I've been asked to talk about my life's journey, because I feel I haven't even started yet and there's so much more that I have to achieve. That's why I've been asked this about 3 or 4 times by the European Association and during International Women's Day. But this time, you know, at every point our goalpost changes. So this time I had to think of what I wanted to call this talk. And I thought it is beyond the boundaries for sure, but it is also redefining your potential at every stage in your career, and that is something that is essential for all of us to do. And my first part was going to be my journey and the trials and tribulations that I've faced, but Satya has done such a really humbling and comprehensive write-up about me in the introduction. You probably will find some of the overlaps, but I would like, even if they are overlapping, to underline the difficulties that I faced during this journey. So this is a favorite photograph of mine from Gandhi Medical College, 3rd year MBBS, on a picnic. I think it was near Hussain Sagar Lake, and all the boys called me Rendu Jadala Sita, because that was my standard. I used to have 2 plaits with ribbons, and even now we are all together, we meet and go for cruises and things like that, and they still call me that. I had number of nicknames like a Tamil tigress, but the Rendu Jadala Sita kind of stayed. One of the most beautiful moments in your career is your medical school life. The friends that you make in your medical school life last forever. You know, these are everlasting bonds that you grow up with them, they know your aims and goals, and one of the things that they used to always call me is CT Mate Resi, because they all knew I was going to be a cardiothoracic surgeon, or rather I wanted to be a cardiothoracic surgeon. So every birthday card came as to the CT surgeon of our class, CT Mate Resi, because nobody knew whether I would end up making it or not. But anyway, after finishing MBBS, I decided that, you know, we're better off going to the UK to gain the kind of experience. So my husband and I moved to the UK. At that time, we did PLAB exams, and PLAB is one of the most difficult exams. Some of you may be aware that it is the Professional and Linguistic Assessment Board exam, 6 parts, although it has changed in its configuration, the standard of which are very high and difficult to pass. Anyway, that was the beginning of it. The move was challenging because we did not know a single soul in the UK. All I knew is I wanted an FRCS from everywhere possible, and I wanted to be operating on the heart. Those were the only 2 things. So it was the beginning of a journey. Perhaps I knew it would be difficult, but I did not know how difficult. As soon as I landed, which was on my own initially to do the exam, I realized that I had to beat the odds of the culture changes, even the language. We all speak English, but it's quite different when you go to a different country, the way things are phrased. I was learning that, you know, as a female, ethnic person in a foreign country, it wasn't going to be easy. You had to strike a balance, make relationships with so many people to get to know and understand the system. Anyway, I managed to get into a surgical rotation soon after passing PLAB, and I did my rotation in Wales, which is one of the countries in the United Kingdom, as you all know, and rotated between Cardiff, Swansea, and decided to do a stint in Cambridge as well. And then I wanted to go to Cleveland Clinic to do my research, which is an essential requirement for a national trainee to have performed 1 year of research work, and necessarily in a location where you can do and finish your research in 1 year. So I went to this first interview for the cardiothoracic surgical job as a senior house officer, which is obviously a junior doctor cadre, the very first. And I had 2 senior consultant cardiac surgeons interviewing me with the medical personnel there. So one of them just said, as soon as I walked in, 5 of us were shortlisted, 4 of the guys and myself. Only girl, which was a theme that I saw for a very long time wherever I went. And the gentleman said, one of the senior consultants said, oh, why do you want to do cardiac surgery? I know no woman who has done cardiac surgery, and there are no women cardiac surgeons in the UK. So I was kind of stunned, only for a nanosecond, I would say. I looked at him straight in the eye and I said, I'm really surprised to hear your view. I've come from India, where we have female neurosurgeons, female pediatric surgeons, and they all do well. I'm very surprised that I've come 4,500 miles west and I'm hearing this. And that was it. Of course, there was a dead interview after that. Anyway, I couldn't engage very much. I just answered all the questions monotonously, walked out of the room, and I said to the guys, I'm not going to get this job. So anyway, I'll see you all later. But they forced me to stay on. And I said, okay. And then the lady comes out and says, Dr. Deglurkar, can you come in? And I thought, weird country, you know, they want runners up first. So I walked in, and the other consultant who was there, were a very, very proud Englishman, asked me to sit down, and he said, we would very much like to offer you the job. Now that stunned me like anything. And then again, only for a nanosecond, and I looked at him right in the eye once again and I said, but I'm not sure I want to work in this unit anymore. And if anything could kill a career, that was it. And he said, well, why not? I said, I don't think I want to work in a unit where they think women can't be surgeons. I have decided at the age of 7 to become a cardiac surgeon, and I'm very serious that I'm going to do it. Anyway, the conversation went on, and he promised me that I would not lack anything in my training, and we never looked back. Until he passed away a year and a half ago, we've been in touch. He's been one of my mentors. So whatever it was, whatever I said came to my mind, and I spoke it, rightly or wrongly. Looking back, older and wiser, it was probably the lousiest thing to have done in that interview. It could have finished my career, but it seemed to have worked out fine. Essentially, what I'm trying to say is, speak up. Don't hesitate to speak up. What comes to your mind is generally the right thing the very first time. And then I got the job, but I already realized with no uncertain terms that the cultural and the institutional barriers for success had already emerged at that point. So the next challenge was not only to finish your junior doctor's rotation, I had to get a national training number. It is an accredited number in the UK, which then progresses on to get a specialist registration to become a consultant cardiac surgeon. So there were 72 applicants, I was the only woman, and anyway, I did get the job, and I was the first female national trainee in Wales, and after that there have been 3 more trainees. We've had 3 women who have trained in cardiothoracic surgery. At the time I trained, there was no such thing as a European Working Time Directive. There were lots of murmurs and things coming up in terms of Calman training and European Working Time Directive, which basically says you mustn't work more than 40 to 48 hours per week. That's next to impossible in our specialty. So in a time when there was no European Working Time Directive, where we had to work 128 hours when you're on call during the week, was very, very tough. So there were no professional female role models to look up to. You can look at any nook and corner of the country. We had 1 female consultant thoracic surgeon, but there was nobody to talk to, no one you could go to for mentorship as a woman, you know, who needs some mentorship and advice about taking the careers forward. I had many, many male surgical consultants who taught me surgery and were excellent, but there were no female role models. So there were multiple barriers, the long and relentless working hours. It was intense. It does take its toll. Work-life balance, family. I've put these pictures up, you know, because I think the picture at the bottom, the least glamorous one perhaps, you know, in my nightie with all books surrounding and our baby in my lap and both asleep, was perhaps one of those most poignant moments that was captured, which reflected everything that was going on in our lives. The picture of me in scrubs is when I was due 3 days of on-call, And my husband Mukund, who's here, who's been like a rock solid support to me throughout my career, used to bring Abhishek to the unit so that he doesn't forget his mom in 4 days by the time I go back home. It was as difficult as that. And he's an orthopedic surgeon, so balancing two surgical careers was, to say it was difficult is perhaps an understatement. So then I was told, as I was training as a national trainee, I said, you can't be female and do cardiac surgery. I said, well, I am doing cardiac surgery. And then as time went on, they said, well, you can't be female, be married and do cardiac surgery. I said, I assure you, I still have the same husband. And then I was told, well, you can't be female, married and have kids and do cardiac surgery. And then I said, well, here goes. I also have a child now. So at every point, the guys who had this sort of a psychology had to eat a humble pie. But what is important there is, they never caused a dent in my resolution to do what I did. If somebody made a statement like that to me saying, you can't be female and do this, I just used to feel pity, thinking, guys, you guys don't know what I'm capable of. But maybe I was being overconfident, maybe I didn't realize the intensity of it. But they did have a point that I had chosen an extremely difficult line just because there was no work-life balance, which is what we are all trying to change now, so we can encourage everybody to enter the specialty. So you can see that, very proud parents standing beside with our son who became the head boy in the Cathedral School. So balancing work and family life and having a child and an ambitious career, it almost seemed impossible at times. There were times when you're so low down thinking, how am I going to manage all this? But what sees you through is the unwavering family support. Even I felt at times, gosh, how am I going to manage this? My husband and child would say, of course you're going to do it. They never seemed to lose confidence in the fact that I would sail through everything. But nowadays, you all have structured training. My trainees have such a structured training in their surgical skills and the level of mentorship that they have. We didn't have anything like that. We had to pass our assessments. We had to show that we are progressing well in surgery. But the resources that one needs for career development and the fundamental information that you need so you can plan your individual surgical training and everything was only then beginning to emerge in the Royal College of Surgeons. And apart from that, it is not just work-life balance, it is not just surgery. What if you're an individual with leadership skills? What if you're an individual who wants to contribute to the society? What if you want to do so much more other than just being a mother, a surgeon, and which is two very big things anyway in your portfolio. So you need a mentor, and it is really difficult to find somebody who can offer you that holistic mentorship and teach you how to go about taking on leadership roles, which I actually discovered late on in my career. So when I was 7 years old and decided to be a cardiac surgeon, I don't know if some of you may remember a magazine called Illustrated Weekly, which is a very big, large-sized magazine that used to be delivered. There was, in the early 70s, there was an article with heart-lung machines, because cardiopulmonary bypass machines were being worked on and they started using it. And I saw Michael DeBakey's photograph and all these big, humongous machines. And I went and poked my dad's thigh and I said, what are they doing? And he said, well, that's a heart-lung machine. I said, so what are they doing? He said, they're doing open heart surgery. And I just told him, so Dad, that's what I'm going to do. And the person there in the picture, I know at that time was one of the pioneers, Michael DeBakey. So you can just imagine, I had a complete crush on him when all the girls in my class had Sunil Gavaskar and Clive Lloyd and Amitabh Bachchan and everyone. I had heart-lung machines in my mind thinking, this is what I want to do. Really weird, not recommended at all. So can you imagine how pleased I was when I actually met with Michael DeBakey in 2004, because I was doing my research in Cleveland Clinic, and he was actually sitting and reading my paper on gene therapy and ischemic cardiomyopathy, and I won an award. So, the consultant who was my lead there for my work, introduced me to Dr. Debate. He said, you must meet Indu. She's had a crush on you. Apart from her husband, you're the only one she's had a crush on. And then they all took a picture, which now seems, so precious to me, although I didn't realize it at that time. I was dying with embarrassment. So it doesn't end there. Work is difficult, work-life balance is difficult. But when you go abroad, you leave your family behind, you leave your parents here, and that is the biggest thing that you miss. And when I came back from Cleveland Clinic and landed in Hyderabad, within half an hour of being home, I knew my dad was really ill, and I took a history from him, and I thought he would have lower end esophageal cancer. It turned out to be gastric cancer. He was running a hemoglobin of 6. So we went through, in fact, I took time off, loss of pay off, just to stay there and nurse him through his surgery and then the radiotherapy after. In any case, I very successfully completed my training without failing any assessments, and I had a very expansive portfolio of operations compared to many other trainees because I just seemed to get to do all the really difficult cases. When we finished training, it was the worst time to have finished training in the UK. People were advised not to take up cardiac surgery because there was such a bottleneck. We have only 40 units, it was 35 at that time, 40 units, and very few consultant posts. And at that time, there were 33 people who had already got their certification as a specialist, with their specialist registration, looking for consultant jobs. But I didn't have difficulty, but my first job was in Glasgow. And I genuinely went to Glasgow only to do an interview and get interview experience so I could get the job I want. And I was stunned when they phoned and said, we're very happy to offer you the job. So I just told my husband, of course I'm not going to Glasgow. I've got the experience that I did. But he was instrumental in me taking up the job in Glasgow, which meant that we would be living apart for that period of 17 months that it took me to come back to Cardiff. Probably, I would say, for a mother to be separated from her 6-year-old and her husband, living in a country where there is no family support, it's probably what I consider the darkest period in my life. But after 3 weeks, I said, I'm going to leave this job and come back. And he said, no, you're a woman, you've got a consultant's job. If you leave it, they will think it's for other reasons. You stay on. So it was clearly the right decision at that time. And then as soon as I could show what I could do, I ended up getting the job back in Cardiff, and I came back and started work in Cardiff, so we were all together again. But then, having a consultant's job and having your own independent practice and everything is just not enough. You want to do something more for the society. So at that time I realized in Wales there isn't a professional body that can represent cardiothoracic surgery. So I formed, it was very difficult, tried getting many units together and tried getting all of them to speak from the same page is quite difficult. But I approached all the necessary, people, and I formed what's called the Welsh Cardiothoracic Society. And this is the first minister, I suppose, like chief minister equivalent in Wales, Professor Mark Drakeford. He's going to step down next month. He came to inaugurate the Welsh Cardiothoracic Society for us, and we have annual meetings after that. So it's not enough to lead as well. It's not enough to just operate. You want to innovate. So I went to Germany for 1 week to learn the total hybrid aortic arch replacement with the Thoraflex hybrid. They were the pioneers. Malek Shrestha was the one doing it there with the chief of the unit. So I went and spent a week, not a year, came back. And then, of course, it's a very expensive prosthesis. I got our commissioners to authorize it, and we carried the first total hybrid aortic arch replacement, plus coronary bypasses. She needed coronary bypasses as well, by the by. And it was very successful, and it was the first one in Wales. So I've been the lead for, in fact, I stepped down very recently because I've taken on multiple other roles, and it is difficult to manage so many leadership roles. So whilst I was the lead, Cardiff was rated as one of the top 3. I was very humble and I said one of the top 3, but at that time our results were the best as per externally validated data. So, there have been very good things for the unit. We made a lot of development with newer innovations at that point. So I'm not going to go through this whole lot of leadership roles, which I think Satya has already outlined, but Every role taught me something new. Representing 800 consultants at a health board level, sitting in a board meeting, interacting with all the executives, bringing clinical points to the table and doing so, and I was re-elected for 3 times as well, so I ended up doing it for a period of almost 9 years. It gave me invaluable insight, not just into cardiothoracic surgery. I could talk about genetics, what is going on in psychiatry, and radiology, what the problems were in obstetrics and gynecology. So it just gave me that vast breadth of experience, which now I'm trying to use within the Welsh government. And I also realized that there are a number of equality, diversity issues in the UK. I think we all know that. Discrimination and bias is quite rampant. One of the more memorable ones is when I got a scholarship to go to Harvard. It was the only scholarship that was given nationally by the SCTS to attend Harvard. And I think it was one of the most fulfilling things I've done. I've done many leadership courses, even certified, but being in Harvard, and I deliberately did not choose a health-orientated leadership one. I went for the most advanced senior executives course, where I had 88 chief executives, vice presidents, US special counsels, Google executives, you name it, you know, presidents of World Bank from Nigeria, etc. And I was sitting and interacting with them. I was the only doctor, right? And I was hearing everything that was there was corporate, but I wanted to be out of my comfort zone, because you know, once you're out of your comfort zone, you really realize your potential, and you also open up your mind to what the rest of the world is doing. Perhaps I would say it was the most rewarding experience spending time in Harvard, and we've made lots of lifelong friends again. This is the editorial, which you know, I'm the editor-in-chief for this. I design every cover page. No other editor has done that, but I really like to design the cover page, and it is very current. You know, I put up whatever the current problems are, and I try to formulate it as a cover page and then address it in my editorial. So I think these national and international roles, as you keep doing, are just opportunities to interact with so many people. My EACS Women in Cardiothoracic Surgery Committee has every person is from a different country. So you get to learn a lot, you can exchange ideas, you can formulate really effective career strategies as to how to improve, you know, the or at least decrease the attrition rate of women in cardiothoracic surgery or surgical specialties for that matter. And we share a lot of stories, success stories, failure stories, but what we are trying to do is keep on breaking glass ceilings. So what are really the determinants of success or failure? I do feel humble I'm saying all this to, you know, a lot of people who are really so highly achieved, but the first thing I would say is teamwork. The single most important mantra for anybody, no matter where you are, is the ability to get on with people. To be successful, you need to be able to engage with the wider team. And when you are successful, it's not your success, it's the team's success. So last year when NICOR said that my results were the best in the country, I had everyone else, I said it is not my results, it's the team's results. And you can see how happy they were, because they were all being represented. You know, everyone gets criticism, but when there is success, share it completely. When there is criticism or failure, shoulder it independently. That's what my policy has always been. So to any of you aspiring, and this doesn't really apply only to women, you know, if you want to succeed, you really need the confidence and an unwavering resolution to do so. You have to have persistence, resilience, stamina, patience, and you can think big. You know, sky is not the limit. There's a whole galaxy beyond the sky that you can aim for. You can only shatter all these ceilings if you believe that there are no limits. If you don't think big, if you just limit yourself in what you want to do, you are not going to be able to push yourself to your maximum potential. If you have all the strength, you try and demonstrate your leadership capability with, you know, and your strengths with grace and kindness. use authority as a very, very last resort. You can get 99 out of 100 things done with a smile. Exercise authority only when it is essential. And really, don't compare yourself to the others. What X may do, Y may not do, and vice versa. You're a unique individual. You have insight into your capability, and you should just end up doing what your heart tells you and what you feel will be the right thing. Step back at periodic intervals and say, you know, like, where have I been so far? Where am I now? What do I want to do next? And what are the right assignments to get there? It was one such moment, I think, that caused this collaboration for me, which we've been talking about for a very long time. But I just thought now was the right time to do it. I was mentally prepared for the commitment and well and truly ready when I said I would like to collaborate now. So, like I said, you know, getting on with people, follow your intuition, but we all fail. By God, I've failed so many times with so many things. But the important thing is, if you do fail, you don't get discouraged. Just do it more and perhaps a little bit more intelligently than you did it in the past. And I would say, fail your way to success. No shame in that at all. And when you reach there, you will really relish the fruits of your labor. However, if any of you are aspiring to be surgeons, which I hope is indeed the case, you must have an insight into your abilities. Whilst you need all the general expanse of skill set, if you are going to be a surgeon, you need to be dexterous. It doesn't mean a lot of people with reasonable dexterity can train and become good surgeons. If you have innate dexterity, that's even better. But if you want to embark on a surgical career, it is important for you to spot very early on in your career whether surgery is really something that you're going to be able to do. You know, you can train as much as you like, but there has to be a natural flair for handling tissues and you know, doing delicate jobs, etc. The other thing I would say, which I didn't realize until later, is it's not enough to just have a surgical mentor. You need mentorship to be able to develop your potential all around. And it may not all be in one individual. You may have to seek it in different individuals, you know, people with leadership strengths, people with surgical strengths. Don't hesitate to approach. I have hesitated and I do regret it, because if you hesitate to approach, well, maybe the person is too busy, although I know that person is the right person, it's a mistake. Be bold, write an email or drop a note and say, this is what I would like. You'd be surprised at how people actually come out and, you know, well out of their areas of interest and say, yes, I'm happy to mentor you. And that would be a God's blessing. So the other thing for women, we have lots of women here. A lot of girls come and ask, you know, I feel I have to act masculine in order to survive in cardiac surgery. And I say that's absolutely the wrong thing to do. You do not, I am a woman, I am unique, I have my own traits and skills, and the department actually is very good to, you know, it's good for them that they have a woman, like a family, you hold everybody together. Don't ever change your style or be what you are not, because people will see through it. Don't act helpless. Don't act as if you want to be a dependent. You may need help. You go and ask for help. Ask for it with pride, you know. But don't try and adopt a kind of a persona that you are not. You can't do it. You can't achieve high if you do that. People have to accept you for what you are, how straightforward you are, how you speak, how you come across. So that is what needs to be successful. You can improve on your attitudes, you can improve on the way you approach things, but don't change yourself and be what you are not. And like I said, you know, you define success on what your terms are. A's definition of success is very different from B and that of C. Okay? You define what you think is success for you, and you achieve it by your own rules. Don't let anybody influence you with that. You build a life that you're proud of, defined by your rules, your standards, and your integrity. And that, I think, is the most important thing. So, there will be many stumbling blocks, right? Is the glass half full or half empty, right? I think it's half full, always, right? So, you can see stumbling blocks. but I see them as stepping stones. You can look at it whichever way you want. You know, when the institutional mindset is revealed that, you know, female ethnicity, all that is a problem, I just told them, well, leadership is nothing, it's not masculine. Okay, leadership doesn't have a gender, right? Anyone can be a leader, and women can be really good leaders, really good surgeons. There are good surgeons, bad surgeons, they can be men or women, okay? So that is something that we have to accept. And a flexible career for work-life balance is great, which is what we're all trying, but it's also difficult in certain fields. You should be prepared to increase the length of your training, but not change course because of the length of the training. We face a lot of conscious and unconscious bias in the UK, and at every point, you know, it is really difficult to overcome. They will say essential criteria. What they won't say is what really their essential criteria is. If they want a face that fits, my face is not going to fit in a group full of white men or women or whatever. But they have to adapt, right? So that is, it's as simple as that. Whether you should not subject yourself to gender-based or ethnic-based harassment, you have to stick up for yourselves. And this is the thing, in the boardroom, I realize how difficult it must be for people to get to the boardroom. But when you are in the boardroom, you influence the entire board. You are able to change things around. I have single-handedly stopped board motions just by explaining to people the relevance of what I was. And I've been told, my God, if you hadn't said that, we would never have known. And papers don't pass through the board because of that. So important to be influential at that level. But, you know, we have to also change the way we come across. You can criticize something, but do so in a way that you bring the person on board rather than alienating them with the critique. And that is something I have had to learn with. I'm very forthright in how I come across. I have had to learn to speak strategically and say exactly the same thing, but in a nicer way. You know, instead of saying, "Could you do this, please?" I would just go and say, "Hey, don't you think it would be great if we both can finish this?" That's done. You know, people are on board. Simple ways of using words with the same meaning more effectively. So I can't even tell you how humble I feel giving this talk, because it's not a talk about me. It's a talk about my family and my friends who have supported me through my career. You know, on your left are my mother-in-law and father-in-law. This is my favorite photograph. And on the right are my mom and dad, and in the middle of my first heartbeat and my second heartbeat are there. You know, rightly saying that's it. You know. So again, I have friends, and believe me, we were all in medical school together, right? So this is the same group. We all hang around even now. We have both been through thick and thin together. So savor your friendships. And look, my sisters, you know, we are 5 girls and I'm the youngest in the family. We're sitting with our mother, who looks very regal on her 80th birthday. They have all stuck with me, as have my in-laws, throughout this journey. So today is not about me, it is about everyone who has played a hand in me being able to realize my dream. You know, whether it's my father-in-law or my dad, who are no longer here, I couldn't have done it without them. They have shaped me for what I am. So I've had a lot of mentors. You can see no women there. Hopefully those things will change. Right? So on reflection, I would say a lot of progress has been made about accepting women in surgery. We were 5 consultant cardiothoracic surgeons until 2014, female consultant cardiothoracic surgeons. Now there are 20 in the UK, but it was a very long time. Until 2014, we were only 5 of us. Right? But now it's quadrupled. So that is again showing how the society is gradually changing. The work-life balance that is being addressed is gradually changing. However, the issues and challenges that confront women as we seek to advance in a changing society, but it is still a male-dominated society. I don't like saying male-dominated. I like to say it's a society predominantly consisting of males, because the males are not going to dominate me anyway. So it's, you know, it's just a way of looking at things. And I really think it's very critical to enroll and empower women. So today, I look back and all the trials and tribulations that I have been through, I feel I can look back and help a dozen other women who come and approach me, and I have students from all over the world who come and spend time with me. The psychology of the society still has a long way to go and needs to change, and that is where these talks help. And you know, all the men in the room will also understand the pain that we have been through and become more empathetic towards, you know, promoting women surgeons. You shouldn't be promoted because you're a woman, but you shouldn't not be promoted because you're a woman either. And that is the most important thing. You know, like when I got my European chair job, I simply said, you know, I don't want the job because I'm a woman, right? However, don't stop giving me the job because I'm an ethnic woman. I'm equally capable of doing it. And there we are. I am the chair of the European Society for Women in Cardiothoracic Surgery. And I look back and think that, you know, at every point in time, I used to think, well, you can't cross the ocean if you don't have the courage to lose sight of the shore. Okay, that's the first thing. And whilst you're swimming, if you have a smooth sea, it never makes a good sailor. A sailor who's been through rough and tough is a much better sailor any day than somebody who's had it all on a silver platter, on a, you know, a carpet of red roses or whatever. So I've had a lot of difficulty, and thanks to everybody around me, I have actually faced it, and I'm able to talk and share my difficulties with all of you today. I have to say a really special thanks to Professor Kumar for this honor. I don't know why he felt that I was, you know, deserving of this, but I'm truly humbled. And to all of you and SVIMS University for the excellent hospitality. You know, I don't know if Vishnu and Pavan are here, Satya. Yesterday's MDT was excellent. Everything has been superb, and I see there is so much we can do collaboratively, work towards, you know, exchanging mutual ideas, learning the good and the not so good from each other. And above all, I have to say, this is not just a fulfilling professional experience. Yesterday was so much of a fulfilling emotional and spiritual, on a spiritual and emotional level for both of us, because my husband and I have been through a lot of difficulties together, many aspects in terms of fighting for health, COVID times and everything, and we have come through it all. And yesterday was one of the most fulfilling moments in our lives, and we really treasure it, and we treasure every moment of these 2 days. So thank you all very much.
That's only Bahubali part 1. You have seen a very dynamic lady, you know, coming up in life. But what is much more difficult is to groom such ladies. So we have Bahubali 2, my friend Vinod, this one to please come and share his feelings of grooming such a wife, dynamic bully wife.
Oh my God, that's you putting me on the spot now. When I proposed to INDU, the first thing she said to me, you know, I want to become cardiac surgeon. And I was doing post-graduation at that time. And I thought, okay, you want to become cardiac surgeon, fine, I'm a surgeon, so I can understand. But I never thought what I'm getting into. And it was really a tough time for running 2 surgical careers in our lives. There are days when I don't see her for 2 days because she's so busy in theatre. And I can understand, that means I had to cook myself. And I had to prepare a meal for her because she is so tired by the time she comes home, she just wants to catch up with sleep. Besides that, yes, you see our son's photo. He's grown up now, so when he was finishing his what you call A levels or junior college levels, we asked him what he wants to become. And he said, looking at you two guys, I'm not going to be a doctor. And I thought, I mean, see, the dream of any father is that your children should succeed or go to a higher post than you are. And he said, no, I'm not going to become a doctor. And I said, I asked him why. He said, look, you guys go and save one life a day. Yes? But if I go into corporate world, I can save 1,000 lives. And I thought, look, and this is what the new generation thinking is. This is what these guys are thinking about. The new generation is not looking just a single career. They want to save multiple lives. And he said, if I earn enough that, I can save 1,000 lives. And that's why I'm not going to become a doctor. And I was really shocked and surprised of how grown up he became on his thinking. And I want to thank Professor Ravi Kumar for bringing us here. We really appreciate the hospitality we had. We had excellent darshan yesterday, and all of you have been so kind and helpful. Few years ago, I was in a similar situation. We visited Tirupati, which is another hospital plus medical college in near Goa, and we went there to do charity work for 10 days. So we had a team of anesthetists, surgeons, physiotherapists, even IT people from UK visit that hospital every year in month of Jan or February. So on those lines, I think we can form similar schemes here, and hopefully we'll make good progress. Thank you very much.
Thank you so much, ma'am, for giving an excellent speech. I think I am the only person who can understand the sufferings, because I am going in the same lines what you are. Being a first woman from Jipmar, I can understand how things go on. Hopefully these children will get some interest in cardiac surgery. Please discuss with madam any queries. Please interact with madam. It's a great opportunity to meet madam. I would like to invite Vanaja madam to give us a few words.
Indu madam, it was really yesterday quality and today your journey both are really useful to our students. And maybe nowadays many are not opting cardiothoracic surgery. Now our students get motivated and few may come to surgical branches and especially cardiothoracic surgery. Thank you.
A few students.
నమో వెంకటేశాయ. ముఖ్యమంత్రి శ్రీ జగన్మోహన్ రెడ్డి గారు, చైర్మన్ శ్రీ భూమన కరుణాకర్ రెడ్డి గారు, మన ప్రియతమ ఈఓ గారు ధర్మారెడ్డి గారు, తరువాత మన జేఈఓ మేడం సదాభార్గవ్ గారు, వీళ్ళందరి సహకారంతో స్విమ్స్ని ఒక అంతర్జాతీయ వైద్య విశ్వవిద్యాలయంగా తీర్చిదిద్దే దానిలో మొదటి మెట్టుగా ఈరోజు ఇంగ్లాండ్ నుంచి మనకు ప్రముఖ కార్డియోథొరాసిక్ సర్జన్ డాక్టర్ ఇందు దెగ్లూర్కర్ గారు కార్డిఫ్ నుంచి 2 రోజుల పర్యటనకు స్విమ్స్కి వచ్చారు. వారి భర్త అయినటువంటి శ్రీ ముకుంద్ గారు ఆర్థోపెడిక్ సర్జను. ఇద్దరు కూడా స్విమ్స్లో అన్ని డిపార్ట్మెంట్ని పర్యటించి ఇక్కడ ఉన్నటువంటి డాక్టర్లందరితో ఇంటరాక్ట్ అవ్వడం జరిగింది. నిన్న డాక్టర్ ఇందు క్వాలిటీ ఇన్ హెల్త్ కేర్ అనేటువంటి అంశం మీద ఒక చక్కని ఉపన్యాసం చేశారు. ఈరోజు తాను గాంధీ మెడికల్ కాలేజీలో మొదలైంది MBBS స్టూడెంట్గా మొదలైనప్పటి నుంచి ఈ అత్యున్నత శిఖరాలు అందుకోవడంలో ఉన్నటువంటి ఒడిదుడుకులు, ముఖ్యంగా ఆడపిల్లలు ఈ కెరియర్లో ఎదగడానికి పడేటువంటి కష్టాలు, ఛాలెంజెస్, వాటిని ఎలా ఎదుర్కొని ముందుకు సాగాలి అనేటువంటి విషయంపై మన పద్మావతి విమెన్స్ మెడికల్ కాలేజీలో ఉన్నటువంటి ఈ వైద్య విద్యార్థులందరికీ ఒక స్ఫూర్తిదాయకమైనటువంటి ప్రసంగాన్ని ఇచ్చారు. ఇది ఇంగ్లాండ్లో వారి యూనిట్తో తొలి అడుగు మాత్రమే. మనం రాబోయే కాలంలో మన విద్యార్థులు కొందరు అక్కడికి ట్రైనింగ్కి వెళ్ళడము, తర్వాత వాళ్ళు దాదాపు 6 నెలలకు ఒకసారి ఇక్కడికి వచ్చి మనకు సర్జరీలో, ఇంటెన్సివ్ కేర్లో, ఇతర విభాగాల్లో మన డాక్టర్లకు, నర్సులకు, టెక్నీషియన్లకు తర్ఫీదు ఇవ్వడం అనేది జరుగుతుంది. అందువల్ల ఈ 2024లో మనము అంతర్జాతీయ ప్రమాణాలు అందుకోవడానికి దిశగా తొలి అడుగు వేస్తూ ఉన్నాం. ధన్యవాదాలు.
Thank you.